Okay, so I apologize. Sorry for my voice. I am a little sick. And I want to talk really quick about this whole capping travel nurse pay. Some people on my Instagram have asked me about it, want me to talk about it. So we're going to talk about it. I got Peppa Pig on over here. My daughter's in the back. My son's napping. So anyways, we'll see how this goes. But okay, so first and foremost, I think it's bullshit. I think that it is the most ridiculous thing that we are choosing to focus on in the nursing world, given everything that's gone on in the last 2 years with healthcare in general, but specifically nursing. So if you don't know, I am an ICU nurse. I've never actually done travel nursing though. I work as core staff in the ICU, and I would love to do travel nursing. I'd love to make that extra cash, but it just wouldn't really work for my family and kids and all that. So, side note. Anyways, so I think it's crazy that we're focusing on this. Let's first let's break down why travel nurses are making so much money right now and why it has gone up. So, first, demand. There are more sick patients, the hospitals are overwhelmed, and nurses, core staff nurses, are leaving the bedside because they are burnt out, they're overwhelmed. The nurse to patient ratios are just off the charts with acuity and how many patients nurses are having to take on. They're doing the workload of what 2 or 3 nurses, should be doing. And so they're like, well, if I'm going to be doing this job, I might as well leave this core staff position and go be a travel nurse and make a bunch of money. Hospitals are having to fill those empty spots with the core staff nurses leaving, that they get travel contracts opened up so that way they can fill those spots with travel nurses. Because as a core staff nurse, you're not making nearly as much money as travel nurses, and which is fine. I'm not trying to complain about the travel nurses making a lot of money. They deserve it. They're leaving their families, they're leaving their homes, they're leaving their kids, their husbands, their wives, their partners, whatever. And they deserve to make that money. But it's can we focus on, safe nursing patient ratios? Can we focus on fixing the staffing issue? Can we pay our core staff members more so that we stop losing them to travel nurse positions? It's not that the travel nurse positions need to be capped. If anything, that's going to make the problem worse, because now these travel nurses are going to be well, you're going to cap my pay. Screw you. I'm just going to leave nursing altogether. And we don't want that either. I appreciate travel nurses because they help fill this void, but there'd be less of a void to fill if we treated our core staff people right. We had better nurse to patient ratios, and we just had overall better staffing in general. So let me know what you guys think.